I'm Dr. Perry Gadalovich, and in this video, I'm going to be reviewing the consent form for a mastopexy or a breast lift. A mastopexy or a breast lift is a day surgery performed under general anesthesia that takes about an hour to an hour and a half to perform. The risks of general anesthesia today are less than driving in a car, but include deep vein thrombosis in the legs, which is why we give you compression socks to wear, and nausea and vomiting, for which we have prescribed you some medication. You can also have a little soreness in the throat, which is related to the tube that we use during the general anesthesia, and so you can prepare some cough drops at home to help with that. In terms of recovery from breast lift or mastopexy, it is not a very painful surgery, and the majority of the pain is in the first 2 days, for which you have been prescribed anti-pain medication. Most commonly, the one we use is Dilaudid, in addition to extra strength Tylenol. The scars for breast lift are around the nipple areola complex, a vertical scar, and a horizontal scar. So the risks and complications of the surgery include a bleeding, which is extremely rare, less than 1%. And if it happens, one breast will be a lot larger, firmer, more painful than the other side, and quite purplish to the eye. If you're worried about this, call the emergency line. Usually that would happen in the first 24 hours, but again, it is quite rare. Infection is extremely rare, and I've never actually seen it in my practice. That's probably because we give everybody antibiotics the morning of surgery and then for a week after the surgery. Often what people will describe as an infection is actually a healing delay, and where the two incisions meet at the junction of the T incision, the humidity and the weight of the breast can cause a little bit of opening up. That probably happens around 10 to 20% of the time. These are minor wound complications that heal in all by themselves and require a little bit of TLC with keeping the area dry and clean with a little gauze in the bra. For the first week, you don't have anything to do. You just keep your bra on, and then we will see you back at a week, remove your dressings, and then you'll be able to shower. Other risks and complications are related to asymmetry. So the breasts are not identical twins, they're sisters. There are going to be little differences between both sides before surgery and after surgery as well. Even if we do our best to give you the most symmetrical result, there will still be differences after the surgery. The scars, as I described, are in a boat anchor pattern, and we begin scar therapy only after a month. In the beginning, the scars are going to look very crinkly, and this is normal, before they flatten out and form a nice fine line. It is rare to have something called fat necrosis, but it is possible. This is areas inside the breast that don't like the repositioning of the breast and can feel firm to the touch. For patients close to the age of 40, this is the reason we get a mammogram before surgery, so that we don't have to worry about any of those areas after the surgery. In patients who have had significant ptosis, which means descent of your breast, if you were to lose a lot of weight after the surgery, that descent would recur. Otherwise, the result is pretty stable and will last for years. Nipple necrosis is a risk with any breast surgery, and it is extremely rare. I've seen it once in my practice in a very complex case. A straightforward mastopexy is not at risk of having this. Nipple sensation is something that can change after surgery, but it is temporary. For the most part, this will return to normal between 6 months and a year, and massaging the area is the best way to bring the sensation back to the nipples, or alternatively, if they are too sensitive, to decrease the sensation to the nipples. Having a little bit of swelling after the surgery is normal, and you might even hear a little swishing in the breast, which is completely normal and nothing to be worried about.